Hey there, Dr. Shelby here at Evolve Chiropractic in Woodstock to give you some more lacrosse ball tips and tricks. Today we're going to focus on the posterior shoulder, so kind of right behind your shoulder as you're moving it. I'm sure that you felt some sort of pain, pulling, or tightness there. We often sit in this world, right? We're sitting at a desk, everything's kind of pulled forward, or we're looking down over at our phone. And what that does is that starts to pull at all the musculature and the soft tissue in our posterior shoulder, or that holds and starts to move our shoulder. So the supraspinatus, infraspinatus, teres minor, all those rotator cuff muscles, they can get very tight and can kind of go under a spasm, especially as we pull them forward. So this is a really great way to use your lacrosse ball to get into that area and loosen some stuff up. So we're gonna take the lacrosse ball and we're going to put it right behind where that joint is. So if you start to move your shoulder around, you'll be able to kind of find right where that bone is, and you're gonna come right off that. So you're gonna take the lacrosse ball and you're going to be utilizing a wall to just kind of hold and use pressure onto that lacrosse ball. So with the lacrosse ball, there's a few things that we start with. So I like to call this the seek and destroy, or the hide and seek, whatever you want to call it. So basically I'm just rolling the ball around for the first 30 seconds or so, just to kind of find those areas that cause a little bit of discomfort. Now, second thing to remember is a little bit of discomfort is okay, pain is not. So if you're having to grit your teeth, or you're starting to cry because you have so much pain in that area, you either need to take pressure off or stop completely. We don't want to be pushing into that pain, but a little discomfort is okay. So once I have found that spot that I'm like, oh yep, that's the spot, then I can do a few different things. First is I can sit and hold. I can do little movements, whether they be up and down or side to side. Or if I know a specific movement causes pain or discomfort in my normal movement patterns, I can do that movement. So I can turn my thumb in and out with my hand here. I can bring the arm forward. I can bring it out to the side. Or I can bring it across in front of me. Now again, with lacrosse ball, our goal is a minimum of 2 minutes, no more than 5 minutes in an area, and ideally we're doing this 2 to 3 times a day. So go ahead and try this out and see what works.